Well, good afternoon. Denise Fair and I are going to do an update today, and I'm going to ask the people of this city for help in a way that I haven't asked for help really since last April, because at this point there's nobody left to deal with this except the residents of the city of Detroit. The rate of infections in Detroit continues to climb. And we know exactly why it continues to climb, and we're the only ones that can stop it. We don't need help from Washington. We don't need help from Lansing. We don't need anybody else. We've got the ability right now to stop this. So you've seen this map over and over. Michigan continues to be the national hotspot, although it's spreading now to Illinois and Minnesota. You'll see it spread through the Northwest and the Midwest in the coming weeks. That's pretty much inevitable. But I'm right now just focused on our city. And I showed you a couple of weeks ago that the hot spot started in our area in the tip of the thumb. This last wave of COVID pandemic through Michigan started in the rural areas of this state, and it has spread. And I keep talking about the fact it is spreading toward us. Here's the latest map. It came down through the thumb. Somebody described the COVID map of Michigan as if the Michigan hand had its thumb slammed in a door. I mean, that's the way it looked. It was bright red, kept coming down until it has reached the city of Detroit in a big way. Here's the bad news. It's going to get worse. I can just tell you mathematically, looking at what's happened. The worst is still ahead of us. And I'm going to show you again the county maps and the infection rates that I keep showing you. Here's Macomb County. Up here are Lapeer and St. Clair. The areas of the thumb where it's been spreading bright red. Today, Lapeer County is at a 28% infection rate. More than a quarter of its residents are probably COVID positive. Next door is St. Clair County at 29%. It is spreading down in numbers we have not seen in a year. And it's spread down through Macomb County at 24%, and Detroit is sitting at 21%. It is going to get worse. There is no doubt that that wave is going to continue to spread down into our city, and we have got to protect ourselves. And if you look at Oakland County, where it should be spreading to, they're only at 16%. And you can guess as to why I'm going to tell you the Oakland County infection rate is lower. The people of Oakland County did a much better job of protecting themselves by getting vaccinated. It's just the truth. And so if you look at the vaccination rates, our lower vaccine rate is leaving our neighbors vulnerable in just a terrible way. The current vaccination rates, Oakland County is at 48%. Almost half of every adult in Oakland County has been vaccinated. The wealthiest, most highly educated people are getting vaccinated across this state in the largest numbers. The wealthier communities are virtually all vaccinated. They didn't listen to any of the nonsense. They had access to the best doctors, and they went out and got vaccinated. And in Macomb County, it's 39%, although they've certainly picked it up. And we are now today at 25%, which means that as this continues to spread, it is going to hit us much harder. These numbers in a couple of weeks are very likely to be worse. And I want to talk to you today about what we can do to deal with it. Now, last week in Macomb County, in Sterling Heights, they're starting to take this seriously. These folks stood outside in the rain for 3 hours when vaccines became eligible. That was a 3-hour line that people stood in Macomb County. Here in the city of Detroit, we've had immediate access to vaccines. You can call today and be at TCF tomorrow in the convenience of a drive-through, no rain or anything else. We have access. And I need to spend a minute, and it's going to make some folks uncomfortable. But we've got to talk about the racial disparity in health care in this country. It's very real. It's something that I know personally. In 2003, the Detroit Medical Center Board of Directors voted to close Receiving Hospital, voted to close Hutzel Hospital, voted to close Karmanos Hospital. You can look it up. It was the headlines of all the newspapers. Longtime Detroiters remember. They announced Hutzel receiving closing, and they were about to close Sinai Grace Hospital. Can you imagine the impact on this city if the uninsured in this community did not have Receiving or Sinai Grace to go to, if the pregnant women did not have Hutzel to go to? The racial disparities in health care in this state would have been devastating. I was working as prosecutor at the time, and the board offered me the job to run the Detroit Medical Center. And I said, I'll take it on one condition. You have to stop the closing of these hospitals for 6 months and give me a chance to turn them around. I'm not taking this job to close hospitals. I'm taking this job to try to reduce the racial gap in health care in this country and make sure these hospitals can succeed long term. The success I had wasn't me, it was a great team. And so Receiving Hospital was on the verge of closing, put a president in there by the name of Iris Taylor. And she did an outstanding job of turning Receiving Hospital around, cleaning up the emergency rooms. And then at Sinai Grace, we had a hospital president by the name of Conrad Mallett, who turned Sinai Grace around. These are people who have dedicated their lives to eliminating racial disparities in health care. And today, Receiving Hospital and Sinai Grace Hospital are open, and there are probably no two people more responsible for Receiving and Sinai Grace being open today than Iris Taylor and Conrad Mallett. And today, Conrad Mallett is working for you as deputy mayor, overseeing the health care outreach. Iris Taylor is working as the deputy health director in charge of nursing. She's setting up all the community clinics. We have folks who have spent their lives doing it. And for that reason, we've got something that's just the opposite. The racial health care gap in this country has existed largely because black people could not get access to health care. We have an interesting situation. African Americans in Detroit can get your Moderna and Pfizer test tomorrow with one phone call. And people in the suburbs have to stand in line in the rain for 3 hours. At the city level, we have done what we can do to increase the access. And what we have to do now as a community is to convince our neighbors who aren't taking advantage of that they're putting their lives at risk. And I'm just going to continue to show you more numbers. Our hospitalizations, this is just City of Detroit hospitals. We now today have 419 people hospitalized in the City of Detroit. And let me show you what we have. 125 of them are in intensive care today. 79 of our neighbors are on ventilators today. And I can guarantee you those 79 people on the ventilators struggling for their lives have one thing in common. They did not get vaccinated. That's the one unifying principle of everybody who's on a ventilator there today. And again, I'm going to give you facts, and a lot of times they're uncomfortable facts. But in this country, about 30% of COVID patients who have been on the ventilator haven't survived. At one point, it was 50%. Things have certainly gotten better. This was Benny Napoleon, who was having good days on the ventilator, and you just don't know when it is going to turn. These folks on the ventilator, we know, very likely, 25, 26, 27 of our neighbors are not going to make it. And here's the question that we have to ask. Why did folks not get their vaccinations? In the first 10 days of April, we lost 22 of our neighbors, highest numbers we've seen in a year. Who were they? 19 were African American, 2 Caucasian, and 1 who's classified as other race. This is the truth. If an African American gets COVID, he or she is 2 to 3 times more likely to die from it than a Caucasian. We know how to prevent this. But the folks who are dying are the ones that we should be fighting the hardest to save. And this is going to be heartbreaking as you look at this. The people who died in the last 10 days, 10 of them were over the age of 70. They could have had a vaccine from early January. Another 5 were over 60. They could have had a vaccine since January. 15 funerals for people who had the opportunity with the phone call to get into TCF and get a vaccination. We lost 3 between 50 and 59. We're seeing what we haven't seen before, 3 between 40 and 49, and another between 30 and 39 is hitting younger people harder. This British variant is hitting people harder than what we saw a year ago. And so here's the question that Denise Fair and Conrad Mallett and Iris Taylor and I have to keep asking. Have we done enough for outreach? Why did these 70-year-olds not take advantage? Did we not do a good enough job publicizing? Did they not know about the $2 an hour ride and didn't have access? Did they read something on the internet and believe one of these nonsensical stories about why you shouldn't get a vaccine? Or did they have nobody in their life who cared enough to reach out to them and said, hey, let me take you up to TCF? It's likely that it's a mix of all of those things. But here's what I know right now. Every single Detroiter 60 and up can get vaccinated tomorrow with one phone call. In every one of the funerals going forward, we're going to have to ask ourselves as a community, could we have done more to care for our neighbors? And so these are the folks I want to reach out to. In any other time, this would be a remarkable accomplishment. 128,000 Detroiters have been vaccinated in 3 months. They've gotten at least their first shot, 128,000. And I want to talk today to those 128,000 people. We need your help. Right now, the people of the city have heard lots of speeches from me, have heard lots of speeches from Denise Fair, they've heard everything from Dr. Fauci, etc. What they need to hear are the stories of people they trust, people in their lives, their relatives, their friends. You went through it. You might have been willing, you might have been nervous, you might have been scared, but everybody I have talked to has been through it has said, I'm so glad I did it. It wasn't nearly as bad as I thought. The stress is out of my life. I'm not afraid to be giving it to my mom, to my grandmother, to my family members. We need the 128,000 of you who have been vaccinated to reach out to somebody who hasn't. Tell them the story. Reassure them. Go with them. This is where we need to be. When we knocked this virus down last year, I got the test site set up, and I guess I took some basketball hoops down, but we weren't the ones that knocked the infection rate down. It was the people of the city wearing masks and distancing. It was the people of Detroit watching out for each other that was the national model for bringing COVID under control. We need to reach out to each other again right now. Now, here's the good news. Yesterday, we all heard about the pause on the Johnson & Johnson vaccine. I can tell you with certainty it will have no effect on Detroit's vaccine effort. Because in this city, we've given people options. Denise Fair and the Health Department have administered 252,000 vaccine doses. 248,000 were the Pfizer, Moderna 2-shot doses, and only 4,000 were Johnson & Johnson. The people of this city have been electing 98% to do the Pfizer, Moderna vaccines. We are geared up for it. The Johnson & Johnson pause has a minimal effect on our efforts. It should not slow you down for a single day in making your appointment. And so I believe in choice. I believe Johnson & Johnson is ultimately going to be shown to be a good vaccine. I think it's going to be put back in place. But what we had planned for this week were a number of places where you could get the Pfizer 2-shot vaccine and the Northwest Activity Center and 8 neighborhood sites where you could get the Johnson & Johnson 1-shot vaccine. And we left the option to Detroiters, pick what you want. When we got the phone call at 7 o'clock yesterday morning that Johnson & Johnson had been paused, Denise Fair and Iris Taylor, the team, within 20 minutes, just flipped the Johnson & Johnson sites over to the Moderna and Pfizer vaccines. We set out the other brand, and we just kept going on as scheduled. And that's what we're doing. If you scheduled a Johnson & Johnson appointment this week, if you show up, you'll get a Moderna or Pfizer shot. We'll set you with your second appointment in the same place 3 weeks later. All you got to do is show up at the time you were scheduled and the place you were scheduled. You should have gotten a text message already that told you this. So in the city of Detroit, we are not missing a beat from the Johnson & Johnson pause. Everybody can still get their vaccine on the date they were scheduled. We were ready for this. And so this week and every week, Monday through Friday at the Northwest Activity Center, we were running Johnson & Johnson. We'll now be running Moderna and Pfizer. So you don't want to come down to TCF, you're in Northwest Detroit, you want to go to the Northwest Activity Center this week, next week. Monday through Friday, we will be available and open with a second site for Pfizer and Moderna. Today, the Brenda Scott Academy and Cass Tech pop-up sites are being administered. We've only had a few people who haven't shown up. The great majority of people perfectly happy to switch to the other vaccine. Tomorrow at the Bright Hub Center on the west side and the Islamic Center of Detroit, just show up at your scheduled time, or on Friday at East English Village Prep. All you got to do is show up at your scheduled time, and you will get vaccinated as you had planned. This is the way this health department responds. So today, you dial one number, 313-230-0505, and you've got all kinds of choices. The TCF drive-through, the Northwest Activity Center, the neighborhood sites I just showed you, Community Saturdays, which this Saturday will be Fellowship Chapel on West Outer Drive, Second Ebenezer, over near McNichols and 75, and Greater Grace we will be out at on the far west side this Saturday. You can show up to any of those. Call and make an appointment. Even if you don't make an appointment, if you show up on the Saturdays of the sites and just walk in, they will take you and give you a shot. We're trying to make this as easy as we can. And we are going to move next week to walk-ins. We're going to set up locations that Iris Taylor's working on right now, where we will just have sites that you can walk in without an appointment, come on in and get your shot. And that's going to be the next expansion that we'll be talking about probably Monday of next week. We're going to keep making it easier and easier. We're doing one more thing to make it easier. There are a lot of sites now in the city, particularly drugstores, that aren't run by the Detroit Health Department. So we have help now. There are actually 24 different vaccine sites in the city of Detroit that you can go. And you can see on the map there, they're in every corner of the city. So we now have 24 different sites. And you want to know where they are? All you have to do is go to our website, detroitmi.gov. And you'll see the logo, find a vaccine in your neighborhood. You click on it, it takes you to the map. And if you don't want to fool around with your computer, we have a text process now. You can text your address to us, and we will send you right back on your smartphone the 3 locations nearest you. So if you take out your phone right now and text 313-217-3732 and put in your address. I did this yesterday. It works. It's a remarkable thing. But you text it, and you will immediately get these messages. It will be the 3 locations nearest you, whether it's a drugstore, whether it's the city at the Northwest Activity Center, whatever the case may be, it'll tell you the 3 closest locations. So if transportation is an issue, or schedule is an issue, we are going to continue to make it easier and easier. And so at the city side, we are doing everything we can to have the most accessible COVID vaccines of any city in the country. I think we've done that. And now, if the 128,000 Detroiters have gotten their vaccine, we'll reach out to somebody and say, I'll go with you. Come on and sign up. It's easy. You can text, you can call, but because you're in the city of Detroit, you don't have to stand outside in the rain. We'll get you in right away. We know right now our biggest enemy is a lack of information or misinformation. And what is also going to be rolled out is an intensely complete information campaign, everything from public forums to neighbors knocking on your doors to trusted advisors in your community, and to talk about the next steps in rolling out the public information campaign is our Health Director, Denise Fair.
Thank you, Mr. Mayor. First, let me just echo the mayor's comments that we are continuing to see an exponential rise in COVID-19 cases. To put this in perspective, every day we are getting about 700 more people that are testing positive for COVID, and it is vitally important now more than ever to get vaccinated, and now it's available to everyone ages 16 years and older. As a city, the mayor has made it possible for everyone to get vaccinated in a variety of spaces. No one can tell us that we did not put in the effort. But we have a long way to go before we get to community immunity of 70%. We are now approaching about 24%. I believe we've done a good job of letting you know how and also where to get the vaccine, but now we need to shift our focus to telling you why it's vitally important. And I've said this before, the mayor just said it, but I'm going to say it one more time so that you hear us when we say Black and brown communities are 2 to 3 times more likely to get COVID and to die from it. And I can speak as a Black woman that there has been and continues to be mistrust in our community. I've had people come to me personally to say that you are a governmental official and therefore I don't believe you. And so we know that's happening in our community, so you don't have to just take our word for it. Talk to your friends and your family who have already received their vaccine. Again, we want to keep you informed. And so we are rolling out an informational education campaign to focus on vaccine confidence, because we know you have questions, we know you may be fearful, and our job is to keep you informed so that you make the best decision for yourself and your family and your friends regarding the vaccine. So starting tonight, we are going to host our first town hall. It's a telephone town hall tonight, where you can just give us a call and the information is on your screen. We will have 3 medical doctors there who will answer all of your questions. And then tomorrow, we'll host a third town hall for residents in Southwest Detroit, hosted by Mary Munoz, the CEO of LACED, and we've partnered with LACED on numerous occasions, providing pop-ups in her location. So again, all these town halls will have medical doctors there to answer your questions. So please do tune in tonight as well as tomorrow. If you are unable to attend, we encourage you to call our nurses right now at the Detroit Health Department. They're available Monday through Friday from 8 o'clock in the morning until 8 o'clock at night. There's nurses available to answer all of your questions. Again, call us at 313-876-4000. And as a final note, we've been in this pandemic for over a year, and I know you are tired. I know you are tired of wearing your mask, you're tired of practicing social distancing, but let's stay focused. We cannot let our guard down. Our goal is to save lives. And so one of the ways we can continue to save lives is to keep wearing your mask, observe social distancing, and wash your hands, and of course, get vaccinated. And so with that, I'll turn it back over to the mayor.
And we'll take any questions.
Hello, Eli Newman, WDET, Detroit Public Radio. Thank you for your availability today. A couple days ago, the director of the CDC, when looking at Michigan's rising cases, basically said that expanding vaccination efforts would not be enough to deal with these surging cases, hospitalizations, and that the best course of action would be to enact similar closures as we experienced last spring and summer. So I guess I'm wondering if the goal of this community outreach campaign is to lessen these cases. Why is that not a part of the the initiative.
And we have talked about wearing masks and social distancing in every single conversation. The governor has a decision to make, but here's what I would say. There is no evidence of widespread COVID infections from restaurants or gyms. Telling the governor to shut these things down, we know what's happening. It's gatherings in homes, it's gatherings in backyards, it's private gatherings where this is spreading. And the residents of this city need to mask up. But the governor's question is this: if she shuts these things down and the gatherings are in private homes, have you really made an impact? Now, in light of the loss of the Johnson & Johnson vaccine statewide, she may need to reevaluate that. But it's the governor's decision, and to me, it's not a clear-cut decision one way or the other, but she's led this state very well, and I have confidence in the decision-making that she's doing.
Sure, and Mayor, can you elaborate on that? Why you don't think that there is evidence that there is this kind of spread happening in places, restaurants, gyms?
We haven't seen it. I mean, we've had a couple of cases, and we've come down very hard on them. But we have just not seen the evidence. If you know evidence of people spreading it at restaurants, the restaurants, you tend to be separated, and they tend to be watched carefully. The staff is wearing masks. If they're not, Denise Fair hits them with a fine in a huge hurry. On the other hand, I've seen a lot of backyard gatherings with 20 people where nobody's wearing masks and are gathered together. I think we need to be honest about what the governor's orders can do and not do. But this is really a conversation you need to direct at the governor. We can control our own decisions as Detroiters to mask up and keep our distancing, which Detroiters have done a reasonably good job of, and we can control our decisions on vaccinations. There is no doubt in my mind the extremely low infection rates in Oakland County and Washtenaw County are directly tied to the extremely high vaccination rates of those communities. We can fight this, but this isn't going to be over in a week or two. COVID's going to be with us for a period of time. We could be in a situation by June where the wealthy communities in this state are all opened up because they're vaccinated, and the poorer communities are not. And that's a real concern as to the direction we're going. So we're focused on, right now, making sure the vaccine's available to everybody and that everybody has the information they need to make the best decision for their health.
Sure, and I mean, addressing that kind of vaccine hesitancy that we're seeing people display, I mean, when the federal health officials are kind of urging the state and local officials to do one thing, and the local and state officials are doing a separate thing, do you feel like that might factor into
No, I think
any of
everybody's
this?
saying get vaccinated. I don't think that's been a confused
No, I mean, in
message.
terms of the restrictions,
No,
though, in
I
terms
don't-
of shutting down.
I don't see that as a factor. People are making decisions to get vaccinated or not based on intensely personal issues.
Sure. And speaking of personal, anecdotes, I got my second vaccine yesterday at the TCF Center, and one of the things that stood out to me, kind of first vaccine versus second vaccine, is how many less people or less cars there were in line at the TCF Center. So, Director Fair, I was wondering if we had a sense of how if the vaccine rates are decreasing week to week, and if we had a sense of by how much.
We can get you that evidence. We haven't seen signs of that. It's a function of how many first, how many second, and now at TCF, we split it into the other side of the building. So we can get you the numbers, but I think we're getting a very high second shot rate.
Sure. I mean, I think I'm just talking about just general. I mean, the line is the same line if it's the first shot or the second shot. And I think I'm just more so speaking. I mean, I know there's new sites and everything, but
No, I'd say that there's no question about it. We are not getting vaccinated at the rate that we should. That's why we're here.
right. All right. Thank you.
Good afternoon. Good to
Good
see you again.
afternoon. Have you got your vaccine shots, Jim?
2 shots
Two
done.
shots. Glad to hear it.
And more than 2 weeks after the second,
All right.
so right there. You just made a comment that I flagged, and I'd like to follow up. And you referenced it earlier, how Oakland County, you mentioned Washtenaw County have low positivity rates, you believe because they have high vaccination rates. Then you just said, so we might see a situation where wealthy communities open up, but poor communities might have to shut down. What did you mean by that?
if the trends that we're seeing now, that Ann Arbor has the highest vaccination rate and the lowest infection rate, when this keeps going for April, May, June, I mean, the governor, if you remember the last year, she opened and closed regions based on infection rate. Caused a lot of anger, but there was a basis to it. If vaccinations vary from area to area and infections vary from area to area, we could see a repeat of last spring where the governor was ordering shutdowns based on infection rates. And so all I'm saying is, right now, the folks in Ann Arbor deserve enormous credit. The folks in Oakland County deserve enormous credit. They've got very high vaccination rates, and they've knocked their infection rates down, and the fact is they are safer. If you rewind things 6 months, you were safer to be in Detroit than in Oakland County off these infection rates. And so I give a lot of credit to the Washoe and Oakland leadership, and I'm hoping with the help of our vaccinated folks in Detroit and people like you, that we will catch up.
Have you and Denise had these conversations with the Whitmer administration? Is that a
Sure.
scenario that we could see?
Again, we talk all the time, and, you know, the governor's orders were by region before, and at some point they may be by region again. Right now, everybody is so intensely focused on getting these vaccinations done that we aren't really talking about the what-ifs in June. We're trying to figure out how to get people vaccinated this week.
Having said that, if it does become a regional issue where she does single out the high positivity rate regions, she's doing a balancing act. She's been under a lot of pressure to do some restrictions, and that came from CDC Director Walensky. It came from Dr. Fauci, where they have suggested Michigan should do more, that they can't vaccinate their way out of this, as my colleague suggested. As a mayor of Detroit, that's a balancing act for you as well. You have restaurants in a high positivity rate area right now, want to stay open, want to be able to make a living, but yet they could be forced to shut down. So how do you
Jim,
reconcile?
I got to tell you, and this is something I don't understand. We have restaurant workers in this town that have not been vaccinated. And I just think you want to keep your job. You want to stay open. There has to be some commitment. But as far as, I'm not getting between the White House and the governor. That's their decision. That's not my role. It is my role to make vaccines available to Detroiters and to see if we can't prevent some unnecessary funerals. And that's what we're trying to do here.
If your region is selected by the governor for a regional shutdown or regional restrictions, your reaction to that would be
Again,
what?
we'll deal with those consequences. Right now, we just want people to get vaccinated and get safe. That's all we're trying to do right now.
Thank you.
Just one last question, Mayor. I'm wondering if the city has considered incentivizing residents to get vaccinated through potentially paying them or any kind of other thing like that.
Right. We've had a number of companies offered to pair giveaways with vaccination days. We are right now, I have a research team looking at how that's being done in other cities. And at the moment, I think there is a 50-50 division on Denise Fair's team as to whether to do it, but we'll make a decision one way or another on that next week. But I appreciate the generosity of a number of companies who have come forward and said if you want us to do giveaways to incentivize, they'd be open to do that. We're just trying to figure out if that would be helpful or not.
And can you elaborate on what the hesitancy of having that kind of program
Yeah,
would be?
I don't want, we're having that conversation internally, and when we reach a decision, we'll explain the rationale for our decision. I don't need to explain the rationale for the decision we won't make.
Fair enough. All right, thank you.
Mayor, we've got a couple of questions from reporters who are watching remotely. First question is, what is the city doing with the Johnson & Johnson vaccines that it has in store right now? Is it?
They're in the storeroom, and if and when the FDA lifts the pause, we'll go back to offering them as an option.
Okay. And Christina Hall from the Free Press wants to know if we're concerned that the pause with Johnson & Johnson might increase hesitancy among individuals to get vaccinated, even if it's Moderna and Pfizer.
Yeah, I think every time there is this kind of negative information out there, it hurts. But I think probably hurts less in the city of Detroit because the people of this city were 98% choosing Moderna, Pfizer already. But anything like that has an impact, and it's all the more reason that people should attend the health department's town halls and ask these questions and get answers that you're comfortable with.
Okay. And Christine Ferretti from the Detroit News wants to know, as part of the city's effort to get individuals to encourage others to get vaccinated, are we enlisting local pastors, sports figures, business leaders, et cetera?
The answer is yes.
Okay.
Because there's intense efforts being made on what you would call trusted voices right now, and we'll be talking about that next week.
Another follow-up on an earlier topic you mentioned, is it starting Monday of next week, you're going to have walk-in availability without appointments?
So right now, if you walk into any one of our church sites or our neighborhood sites, we'll take you without an appointment today. And so we'll do that today. I really believe the next step is this. I would like to have 4 locations geographically spread across the city where you just had a sign out in front that says, come in and get a vaccine free. And to have walk-in sites open 5 days a week in 4 areas of the city. And I know that's what Iris Taylor and the team are working on developing. I think that has to be the next step. We just got to make this vaccine as easy to get in as many locations as possible. That's what we're trying to do.
And so that would theoretically start next Monday?
I think by Monday we'll have an announcement. We're nailing down a couple of conversations with some landlords about sites and the like, but I do expect sometime next week we will have 4 permanent walk-in sites.
Now, I have to ask you the devil's advocate question. Are you concerned that that might become not manageable, that you would get a deluge of people showing up?
If the worst problem I have is too many people want to get vaccinated, we'll deal with it. We have plenty of vaccine and plenty of staff. All right, thank you all very much.